All right, good evening. I'm Senator Julia Kirt, and we'll go ahead and get started. And, if people join us, that's great. And we heard from the House members are still on the floor. So this is the unpredictability of our uh, state capitol world that we never know exactly what will be happening during session. But thank you for coming. We very much appreciate you. I'm the Senate Democratic Leader. I'm very proud that Senator Goodwin is here as well, and we'll hear from her shortly. And then we're expecting Representative Fugate and Representative Provenzano when they finish up with floor bills. I'm not sure. So you would think, since we're both functioning in the state capitol, that we would know what was happening over there that caused a long delay, but we don't. We don't always know what's going on across the rotunda, even though we're in the same building. So it's enough just to keep up with what's happening in the Senate. So what we're going to do, if everyone is hearing, hopefully everyone's hearing or seeing our fabulous ASL interpreter. Thank you very much for coming, Sky. So glad you're here and for your help.
Senator Kirt, can you hear me?
Yes, I sure can.
This is Regina. For whatever reason, now I've lost the video. So bear with me as I try to get the video back on.
Yeah, sure. I'll start, and then if you'll be ready shortly to talk about things you're working on, that'd be great.
All right.
So we'll just start with some updates, and then if the House members are able to get here, we're hoping they are, we'll let them join later. Rep Fugate said he was going to put in a headphone and try to listen. He didn't want to miss if anyone spoke before he arrived. So just so you know that they do want to know what's going on. Anyway, I'm Senator Julia Kirt. We've been doing Capitol conversations for about a year now. We started a year ago with having opportunities at the state capitol for people to come get updates directly from us, but also have a chance to ask questions or give testimony themselves. Our state capitol process does not automatically include public testimony, unlike many states. If any of y'all have followed other states or lived elsewhere, you may know that some state capitals let public comments happen on any bill or any initiative. And so we can't control that. Being in the minority party, we can't change the process, but we can try to make a little piece of it how we want it to be, which is to listen to folks and to hear your concerns during session. This is our first time to try a virtual event. We had heard from some people who have transportation challenges or people who are caregivers who can't get away. And so we wanted to make sure we offered this virtual opportunity. But we will have more in-person events upcoming. We have monthly events. And so those are on the slide that Elizabeth had moving through here. Bear with me if my dog starts barking, because I did get home. So, life. But the dog wanted to be with me, and we can't kick him out when we haven't seen him all day, right? Right. Okay, I want to give you all just a little bit on things I've been working on, things that I think are big issues, and then I'll hand off to Senator Goodwin, and then we'll have a chance for people to speak. This session, this Oklahoma Senate Democrats really, again, as always, focused on trying to support the type of education that every kid deserves and trying to make sure we're giving schools the type of supports they need. We're especially concerned about the Department of Education at the federal level being dismantled and how that's going to impact enforcement of special education and IDEA protections at the state level. So that's been a big priority for us, is to try to put in state statutes some of the things that are federal law, but many states across the country have those things in their state laws to make sure they have protections at the local level. Just worried if we change the whole model of how education works and those money start getting sent in big block grants to our state, we want to make sure those protections are already in place. So that's one avenue of education. Then trying to be in the conversation around literacy. Our colleagues across the aisle want to start initiatives around education, and we just want to make sure they're things that are a long-term commitment to our kids. So making sure that we're not doing one-year initiatives or two-year initiatives, but truly following kids through with the resources they need. Talking about very unpopular things like smaller class sizes and trying to support the educators who are in our classroom and trying to attract educators back. The other big focus of ours is around cost of living, trying to make sure we're improving affordability. And so for me, that's especially around property insurance. Oklahoma has some of the highest property insurance rates in the country. That's both our homes, which we pay either directly or through, what we're paying in rent, and for our cars. We have some of the highest car insurance rates in the country. And we can talk more about that if you're interested. But I did have two bills that failed in committee, but I'm going to keep pressing. And I certainly am not going to put up with us not taking action on insurance this year. And then, of course, our housing market, which in Oklahoma for a long time we've taken for granted low cost housing, and that's just not the case anymore. Rents have risen more than 50%, and many people cannot buy a home now. So those are the big things I've been working on. Just want to mention one bill. Well, I'm going to mention two. We'll see. Since our House members aren't here, I'm going to mention two. One is I have a bill specifically about eviction, and so I've had concerns about our eviction process in Oklahoma, which is one of the fastest in the country. Really don't give people a very long time to catch up or to find their next step if they're being evicted. And last year we passed a bill that would have extended the eviction timeline between when an eviction's filed and when that hearing is by 5 days. That bill got vetoed by the governor. And so I came back this year and we're just trying to add Sundays and holidays because we found the courts are slammed around the holidays. When the timeline includes Thanksgiving or includes Christmas or includes the 4th of July, those are days that service isn't happening, the courts aren't open, but people are still expected to catch up during that time period, even without no bank, even without being able to get paid during those days. And what I find again and again is a lot of people are they fall behind. And if they're only behind for a few days, that's enough to get them on the streets pretty quickly. So we're trying to find something that we can get through the legislature that'll give a little more gap there for people seeking help, either rental assistance or trying to catch up financially, or seeking legal assistance, because legal aid is also very slammed if people need help. So that's SB 1209. It is expected to be heard on the floor this week, so I'll be pushing on that one a lot. And then I want to mention one other bill because it's led to a lot of conversation, which is I've passed a bill through committee and through appropriations that would require our primary care providers to do a once a year mental health screening as a part of like a routine visit. So you go in for one visit, a regular primary care checkup, that we wanted to make sure there's a screener as part of that process. Because what we've learned about our system across the state is a whole lot of primary care docs do not view mental health as part of their responsibility. And we really need to make sure people are viewing the whole picture with their patients. Now, it's interesting. I'll be glad to have a conversation if folks want to have one, but there's a lot of folks that don't like mandates. Patients can opt out. Patients absolutely do not have to participate if they don't want to. But there's a lot of concerns about if folks are screened and do have issues, are they going to be able to access the care they need? And I think that's an incredibly important question and something we need to be working on. But I still think we need to be finding out that information, be making sure that our primary care folks are thinking about behavioral health as part of the whole picture for people. So that bill is Senate Bill 1836. If you want to read it or learn more about it, I'd appreciate it. In terms of concerns, big movements that we've seen, there is a continued movement toward expanding private school vouchers. And I think that's a concern because they've been both expanding the budget, but also expanding the definition of what folks can get money for. And that is private taxpayer money. And my continuing problem is that we don't have clear outcomes. We don't have accountability for that money. It's just what we do know about it is that a huge chunk of it is going to higher income folks, as opposed to something like SNAP, where we check eligibility monthly. The private school vouchers have zero eligibility checks after the initial authorization. So that concerns me. So that's a big movement happening. And then, just the conversation around property taxes. So people are feeling pretty overwhelmed by their property taxes. And I think, frankly, a lot of that's because also our property insurance is so high. But so there's a conversation happening about cutting property taxes, but there's very little conversation about what that impact will be long term. How will that impact public safety, our roads, our schools, our health infrastructure, or really considering what the dollar amount might be. So there's a lot of compromise and discussion happening with very little information. And so that concerns me, because if we cut taxes at the local level, I mean, the chances of us putting them back in place is it would take a real crisis. And I think there's going to be a lot of challenges before we would get there. So those are some of the big movements that I've been concerned about. Trying to focus on some of the good, but we always have to be wary of initiatives that might be harmful to our local communities. With that, I'll hand it off to Senator Goodwin to talk about some of the major things you're seeing and working on.
Thank you, Senator Kirt. I did want to just say that as you were talking about property taxes, we know that last year the income tax rate was cut, and there's a trigger there that it continues. So there's this word around the Capitol about a path to zero. And I know that if we aren't collecting taxes to some degree, how do we take care of our core services? So I don't like this getting on this path to zero. I don't like when I hear about corporations having zero taxes. So I just wanted to just add to what Senator Kirt was saying as it relates to taxes and our tax base. While we don't want to be overtaxed, we certainly want to be able to pay for health and human services, our roads, our schools, et cetera. And we never hear the other side of that conversation when these items get cut. When I came into office many, many moons ago, we were at a $1.5 billion deficit because taxes had been cut. We had to go through that whole process of trying to have the oil and gas industry pay more in taxes. And also there was a cigarette tax and a tax at the gas pump. So that's old history, but it all matters today because when they talk about having a surplus, that surplus, quite frankly, came from the hard work of Democrats many, many years ago because we held the line and we talked about what was important for all of Oklahoma. You know, I want to really hear what the people on the line have to say. I know we're going to get there, but I do want you to know that I've got one bill, and it deals with the teachers' retirement system. And I've heard from a number of people, had about 50 letters. And basically for those folks that have worked in the military, and there's supposed to be an incentive to get more folks into the teaching field. So for these people that have worked in the military, there's a law that says that you can buy back your credits. You can buy back into the system. And simply what they want to do is if they worked, say, some 6 years ago, they want to pay back into the system at the rate of pay that teachers were getting 5 or 6 years ago, not the current rate that teachers are getting now. And I hear from constituents and they say it would cost them $70,000 to buy back into the system. That is not an incentive, right? Everyday folks typically can't do that. So we have a bill that we're trying to make that a little more fair. We've got a pretty healthy, we're at about 80% with our teachers' retirement system. And they're sitting on, you guys, $25 billion. $25 billion, and they pay out about $1.7 billion a year. And so we think we can afford to provide a little more incentive for those folks that want to buy back into the system. So we're just trying to make that a little more fair. I have another bill that's close to my heart. It is simple for me. It's called the Tulsa Reconciliation Education Scholarship Program. And it was born out of this legislature some 25 years ago. And it was related to the Tulsa Race Massacre. And what they said then is, how can we address this issue? And how can we advance education, enhance generations? And it was real simple. They said that all students of all races would be able to get this scholarship. That's why it's called the Reconciliation Scholarship. And we're simply asking that students that are descendants, have priority, that they shall be prioritized. And like I say, that's a work in progress. We already have scholarships here at the Capitol that we have a Folds of Honor scholarship. If you're in the military, you have descendants, they get a scholarship. We have a scholarship for police officers. They have descendants. they get a scholarship. We had another scholarship for those with the Murrah building bombing. And those descendants get a scholarship. So we're simply saying for all the other scholarships over the years, we want to move from this scholarship that says descendants of the race massacre, those are students that they may have preference to that they shall be prioritized like our other scholarships. So we're working on that. And the bottom line is all students, I think, in this day and age need as much help as they can get, most of them, when they're going to college. And the beautiful thing about this scholarship, you can go to a 2-year school, 4-year, public, private. It can be a VOTEC, it can be a community college. And we're simply asking that all of those students be able to receive the same amount of money. And we've done well over the years. We've moved these kids from just getting $1,000 of a scholarship there. They can get like 6,300, and you can get it on a recurring basis over the next 4 years. So you can get roughly $24,000 to help you out with your schooling. And we know this is a great scholarship. That one passed 18-0 out of committee, and it's been passed. It was originated in bipartisan fashion, and we need it to continue in bipartisan fashion. All right, that's it for me for now. But we can certainly fill time, you know that. I want to hear what folks online
Well,
have
I
to
think
say.
I love you wanting to. Will you tell the bill numbers so people have them?
Yes, 2040, 2040, and I believe the I got to double check this. The teachers retirement system bill is 2039. I got to double check that one.
Great. We can put it in the chat if it's anything different. But
Okay.
Thank you so much, Senator Goodwin. Great. Well, I think our House folks are still on the floor, so we will start giving you all the opportunity to speak. I just want to say, for any of you I haven't met face to face, or even if I have, just we're so glad to be here and to get to listen to you. I hope that you feel comfortable to express yourself and know that this is not a high pressure situation, that you have very attentive and supportive legislators in front of you. So if you have nerves, I hope they're quelled, because we are here to hear you. With that, I'll start with Sky. Sky, you are the first person on our list. Thank you for being here.
Thank you. So thank you so much, Senator Kirt, for the opportunity to be here. And I really want to say thank you, Elizabeth, for all you do to organize. You are a rock star. So my name is Sky Collins. I'm the founder of Oklahoma Rare, a grassroots organization working to connect, support, and advocate for Oklahomans living with rare diseases. More importantly than any of that, I'm a mom. My 13-year-old daughter lives with Milan syndrome, an ultra-rare disease that only 390 people in the world have been diagnosed with. So when you hear a number like that, it sounds incredibly rare and isolating. But while one diagnosis may be rare, rare diseases collectively are not. There are more than 10,000 rare diseases. They affect 1 in 10 Americans. So that means here in Oklahoma, we have around 400,000 Oklahomans living with rare diseases. So that is 10% of constituencies, 10% of communities, 1 in 10. So while each diagnosis might be unique, the challenges our families face are shared. Through Oklahoma Rare, we work to build community, elevate patient voices, and bring together families, advocates, providers, and policymakers to improve the systems that people with rare diseases rely on. Last Thursday, in partnership with supporters of Sickle Cell Disease, Inc., we hosted the first ever Oklahoma Rare Disease Town Hall. It gave patients, families, other stakeholders a chance to talk openly about the barriers, challenges, and priorities that they're facing right now. Several themes came up again. First, access to care. Families talked about the lack of provider education and the shortage of specialists. Much of Oklahoma is what families describe as a specialist desert, meaning patients often have to travel out of state just to receive the care they need. While we work to build more specialists here in Oklahoma, we also have to ensure families on Medicaid can still access out-of-state care that they depend on. Right now, we're seeing policy proposals that can make that even harder for families already navigating a really complex system. Second, access to palliative care. Palliative care is often misunderstood as end-of-life care, but for rare disease families, it often means care coordination and support for really complex medical needs. Third, Medicaid work requirements and definitions. Our community has serious concerns about how these policies could affect individuals with complex and unpredictable health needs. And finally, transition to adulthood. Families are worried about what happens when young people with rare diseases age out of pediatric systems and need adult care and support. So these are the things that patients and families are thinking about every day and the things that are keeping us up at night, me included. Our ask is simple. Bring rare disease patients, families, and organizations into every space where decisions are being made about our lives.
I'm here.
Because the policies that you shape directly affect whether families can access care, coordinate services, and support their loved ones. I want to leave you with one quote from a rare disease mom named Ashley, whose son John depends on the system. She said, "When a child's life depends on the system has to work." Rare disease families aren't just asking for help, we want to be partners. So invite us into the rooms where decisions are being made, and together we can build systems that truly work for all Oklahoma families. Thank you.
That's fabulous. Thank you, Sky. I so appreciate you bringing those voices here, and thank you for giving us something we also can share with other people to connect with. And I so appreciate you speaking beyond individual diagnoses, because that's such an issue when we're changing the law and we change it for one, that, we have to look at the system and what's needed there. So I appreciate that.
Senator
Jennifer, you're up next. Are you able to unmute?
Thank you for having me here. I am a mother, caregiver of a son that's living with ADHD, epilepsy, and cognitive delay. I attended the Partners in Policy Making, I think in 2023. I work for Epilepsy Foundation. I'm an accountant there, but I also do community involvement. And I really don't have like an policy, but I just kind of want to talk about some of the issues that my son struggled with, and I feel like it would be a benefit to have it more in the community. He's cognitive delay, so he struggles with reading and remembering because he has epilepsy. So I would like to see like some changes in like the school, like special education. I had this IEP meeting today, and it was great. I really enjoyed it, but it's just like, what else can we do for people living with special needs? Because are we maxing it out to their full potential, or are we just gonna, pass them by because of the funding? Or so I think I want to be really in that area of trying to see how we can advance funding for people living with special needs.
Very appreciated. Thank you, Jennifer. Senator Goodwin, did you want to say something? Thought I heard your voice and then I cut off.
I did. I wanted to say that I know oftentimes when we're in this building, we're addressing some of the rare diseases, they ask about numbers, right? They tend to go where the numbers are, right? And to you all's point, I know that your son and your daughter matters, right? And you're wondering, how do you get help? I just know I got a note today about sickle cell disease funding, looking like it's might not be there as it has been, and it's never really been great. But just to hear about sickle cell disease just today, um, Velvet actually called me. I need to get back to her. She called earlier today, but I'm going to call her after this meeting, after we get off. But it ties in to what you all are talking about. And I wanted to ask very quickly, what is melange, the melange syndrome or disease? And I know we got to move on, but I didn't want to know. I wanted to get educated on what is that.
Thank you so much for asking. So our daughter has Milan syndrome. It is a ultra rare neurodevelopmental syndrome caused by one gene. And we often say our daughter won the lottery of syndromes. It affects every system in her body. So she has an intellectual disability, many health needs, mobility needs. But she's also a Swiftie, and she's in 7th grade. Shout out Putnam City and at Hefner. And in a lot of ways, she's a really she's my third daughter, so she's a really typical teenager. But her dad and I, we did become a one income family to provide the support that she needs, and we would do it a million times over. So families, we have a lot of needs in our community.
Thank you. Thank you.
I'm so grateful for that. And Jennifer, thank you for mentioning partners in policymaking. I think that's a really important program if folks haven't gotten to experience that. I just went to the legislative event the other day, and it was so great to see people learning about roads towards advocacy. So if anyone wants to know more about that, just text us or put something in the chat if you want to learn more about that. Tammy Taylor, is Tammy here? Wonder if that's our principal. I'll have to hassle her if that is. Tammy Taylor is the principal at Putnam City Original, if that's the same one, but it might be a different Tammy. Okay, maybe Tammy didn't make it. Susan, are you here? Susan?
I am here. Thank you so
Hey,
much.
great. Hop right in there.
Thank you. I'm nervous, so I wrote everything down so I didn't ramble. I appreciate so much this opportunity. My name is Susan Hurtado. I'm a licensed clinical social worker in Oklahoma. For the past 30 years, my work has focused on the marginalization in impoverished Oklahomans. I would like to speak today about House Bill 3832 by Representative Stan May, which made it out of committee with a unanimous vote. I recognize that there are many large and consequential bills before the Oklahoma legislature this session, but I would argue that few policies have as direct an impact on people's day-to-day survival as legislation that limits our ability to work. This bill risks further unemployment in Oklahoma, particularly among women who are already at an increased risk of poverty, working mothers, single mothers, people who are already struggling to stay housed and fed. Many of the people I work with want to work. They want to stay off food assistance. They want stability. And policies that remove legal ways for people to earn income move them further from those goals, not closer. The reality is that people with criminal records already face deep barriers to employment. Research consistently shows that individuals with convictions earn significantly less over their lifetime than people without records, which entrenches poverty and reduces economic mobility for families, impacting every single Oklahoman. One of my professional specialties is sex therapy. And in that field, we use a simple framework when evaluating whether behavior is truly problematic. We simply replace the behavior with something non-sexual to see if the concern still exists. For example, imagine we're not talking about erotic dancing. Imagine we're talking about selling popcorn at a Drillers game. One person sells popcorn, another person buys it. Maybe they tip the vendor for walking up and down the bleachers all day. No one finds that exchange morally troubling. No one objects if the popcorn vendor has a prior felony conviction. The only thing that changed in that example is that one form of labor is sexualized and the other is not. So what we are really discussing here is not a concern about employment, wages, or tips. What we are discussing is an individual discomfort with erotic labor itself. In the committee decision, Representative May referenced concerns about 12-year-olds being trafficked. And I want to be very clear, 12-year-olds are not being trafficked in licensed dance clubs. And Oklahoma already has strong laws on the books addressing trafficking and the exploitation of minors. Those laws should be absolutely enforced, but it is important that we don't conflate illegal trafficking of minors with legal consensual labor performed by adults. When those issues are blurred together, it creates policy that harms adults who are legally working while doing nothing to address the real crime of trafficking. House Bill 3832 effectively shrinks an already small set of employment opportunities for people who already have very few. Women, single mothers are already likely to live in poverty. People with felony records already face enormous barriers to employment. This bill compounds those barriers and removes one of the only legal ways people have to support themselves and their families. If our goal as a state is to support working families, reduce poverty, and increase stability, then we should be working to expand pathways to work, not narrowing them. House Bill 3832 does not solve any problems. It simply creates more, and I urge everyone to oppose it. Thank you so much.
Leader
Thank you very
Kirt,
much, Susan.
can I jump in and give a quick update on 3832?
Yeah, this is Rep. Andy Fugate, who is on the House floor, so we're getting the real deal right here.
Yeah, we are just now wrapping things up. Susan, I hear you loud and clear, and I share 100% your observations. I will tell you that we have a two-committee review process here in the House. And yes, it did pass out unanimously from the first level. But the chairman of the Economic and Commerce Committee chose to not hear that bill in committee. So at this point, it's dormant. House rules say that a bill that is in this stage cannot be inserted into another bill. So it is unlikely this bill will advance. That said, there's nothing dead here at the Capitol until we're finished. But I think I would encourage you to keep your advocacy up with all members. But just know that at this point, it's not a live round. It's something to keep your eyes on.
I'm incredibly grateful. Thank you so
Well,
very much.
don't get too relieved because
Yeah.
there's a Senate bill
Yep.
with the same content. And I don't have the number in front of me, but I can find it for you, or Elizabeth and her magical research will happen.
Right.
Senator Hamilton has the same bill on the Senate side, and he was the chairman of the committee, so it was heard in committee. So
And
we'll
I
have to
will
look at
say,
it.
I was in that committee. I voted no. I voted no on the bill because I think they are absolutely taking the, as they say, exotic entertainment industry, and they're equating it with trafficking. And I had said to them, they're taking a giant leap. And I too spoke to those that right, wrong, or indifferent. That is a legal activity. And so their effort to criminalize it, to charge these fines just to have a license, the $30 if you're a dancer, the $1,000 additionally if you have that business. I was a no on it, and it was for those reasons, because they were taking this leap, this legal leap, and to your point, it wasn't solving anything as far as I could see.
Thank you. I would note that online it's showing that it passed with a unanimous vote.
I can tell you, I voted no in committee.
No doubt.
That must
Not
just be on
challenging that
the
at all.
the Senate side, maybe.
Yeah,
Um,
on the Senate side.
But I
with
don't know if they're
Hamilton,
structured the
I was a
same.
no.
So anyway, we will keep an eye on
Yeah.
that one though, because I know I just read it and they were putting the license under the ABLE Commission, which oversees alcohol. So
We questioned that also.
Mhm.
It was
Yeah.
all over the place.
Thank
It was
you
all
for
over
that.
the place.
Thank you
Yep.
for that. And it's good to have you as a resource, Susan, so that it's always good for us to have examples when, things get thrown on the agenda at the last minute and we're trying to figure out how to explain things so that people can understand it differently if they're our colleagues and they are thinking of things in one way. So I appreciate that. But it's Senate Bill 1284 is in the chat. That is, I believe, the same, although you can let me know, Susan, if you would. Look at that. Thank you for that. Looks like we'll probably have our House members here full time in just a minute. But Rebecca Rhodes, Rebecca, are you ready to speak?
Yeah, I'm ready. Susan, I also wrote down everything so that I didn't get too long-winded. I wanted to introduce myself. I'm Rebecca Rhodes. I've worked in the field of public health for 22 years. My background is in epidemiology, and I lead a team at the Hudson College of Public Health at the University of Oklahoma Health Campus. And I'm here to talk about HJR 1077, which puts forward to dissolve TSET, the Tobacco Settlement Endowment Trust. For those of you that don't know, in 1998, attorneys general from 46 states, including Oklahoma, Drew Edmondson was actually one of the lead attorneys in that. They helped sign the master settlement agreement with major tobacco companies, and that secured ongoing payments to Oklahoma from the major tobacco companies as long as cigarettes are sold. Oklahoma is the only state in the nation that created an endowment for those funds. They can only spend the interest on those. Other states put it towards general spending, maybe roads or this pet project or that one. We protected our funds. They can only be used for health. It's in the Constitution, and there's very strict guidelines on what they can use the money for. So I wanted to talk about a couple of really successful projects, and I forgot to start my timer. Shoot. Okay, so I'm going to start talking fast. Tobacco is still the leading cause of death in Oklahoma. And in FY25, nearly 30,000 Oklahomans registered for the Oklahoma Tobacco Helpline Services. And we had a 45.4% quit rate, which exceeds the national benchmark of 30%. And disclaimer, I do evaluation work for the Tobacco Settlement Endowment Trust, so that's why I'm involved in this kind of research and my team. One of the other programs that's really amazing is they work with the Healthcare Workforce Training Commission, which was established by the legislature to place physicians in rural areas and help them with loan repayment if they stay for 4 years. Those physicians have provided 667,000 patient visits. They do cessation counseling, and they also are required to see Sooner Care patients and Medicaid patients. I want to read you a couple of quotes, or maybe just one per time. If it wasn't for the program, I would not even be here, and there would be no obstetrician here. Rural areas present a unique set of problems. There are a lot of people that need to be in specialized centers, but they can't get there, and they don't have a car. There's a really good chance there would be no physicians taking their place if it wasn't for this program. And another one, the reason I stayed and practiced in rural Oklahoma rather than move home after the end of residency was in large part because of this program. And I think I've seen the effects in my own life. It works. You get folks to move to the community, then they fall in love with a small rural community and they stay. Another program, the TSET Healthy Living Program. This is sunsetting June 30th of this year, but it's been around for over 20 years. And we did some research where we worked with the CDC to use a model that they use to estimate impacts of implementing evidence-based interventions in communities for their federal grants. And what we found is if we start with just this latest Healthy Living Group grant, starting in okay. Can I finish that sentence? Okay, so we found if we estimated impacts out to 2040, it would save 1,000 lives, and the medical cost saves would be around $588 million. So that's a great return on investment for prevention work. I'm so sad.
That's fabulous, Rebecca. Will you email us that, or email Elizabeth that, and she can get it to us?
Sure.
If any of you who wrote your testimony down want to send it to us, that would be, we'd welcome that.
Okay. I probably
Yeah,
do
for
need
sure.
to run it by TSET before I
Oh
do
yeah.
that.
If you can't, then I totally get it. Oh, good. So Rep Fugate's going to speak at the end. So he said he'll be sure he talks about that bill at the end. Brandy, are you ready to speak? Maybe Brandy's not on.
Yeah, I believe Brandy was here earlier, but may have had to leave.
Hop off. That's okay. Well, Rep Fugate, are you getting where you'll be able to chat shortly?
Short answer is yes. I'm just walking off the floor now since we're finished.
Okay.
I can go upstairs.
Yeah, if you head that way, and I'll see if there's anyone else that was hoping to speak or ask a question while you're headed there.
I think
Is there...
Rep Timmons is planning to join us as well virtually here shortly. So.
Okay, good deal. Anyone else want to unmute and either ask a question or make a short remark? You are welcome to do so now. Yeah, Gwendolyn, that'd be fine.
So she asked if someone could speak about the possible dissolvement of ODMH into the healthcare authority.
So there are a lot of rumors about agencies moving and being merged or being combined or being separated. One of the strongest rumors is about the Department of Mental Health being moved into the Oklahoma Healthcare Authority as kind of like a division of the Healthcare Authority. There's no active bills on the topic. So if that were to be done, it would be something that would be dropped into budget bills later. So I will say that it's hard to plan for because, unfortunately, process-wise, it doesn't include a lot of stakeholder engagement to ask people what they think about how that would go. So I would say I have heard that from executive level people that they're looking at that possibility and that they think it might be better. I will just say my outlook on it is I'm concerned when we think that moving parts of state government around is going to improve it. I feel strongly that we should check what the root challenges are. Is it funding? Is it leadership? Is it the authority environment? That we need to look at those root causes. And I think for the Department of Mental Health, we can draw it back to underfunding, and that we gave up having a board hire and fire the director and gave that sole authority to the governor, which has led to this, constant. That's my theory anyway. And I think it's borne out in fact, but that is a strong rumor. There is a bill that would move the child welfare portion of Department of Human Services and the Oklahoma Juvenile Authority together into a child welfare agency. That's still in its initial stages as far as being adopted by state leadership. One legislator put it out. He gave it about 24 hours notice in the public eye. So I wouldn't say it's been checked with a lot of folks. I'm not sure if that will happen, but I worry a lot about the amount of transition time there is. Have you, Senator Goodwin or Rep Fugate, have y'all heard anything else about those mergers or splits?
I have not.
Your update was my update.
All right. Well, it looks like Brandy's back on, and right? Is it Brandy? Brandy, are you available to speak now?
Yes, sorry about that. My whole life is Google based, so I had to
I know
download
Microsoft. When they gave our programs are all Microsoft, so we've had to try to figure out if we can make it work for us.
It's okay. It's okay. I just had to get off one device, download an app, and I'm back. Many of you know me. I'm at the Capitol every day. That is appropriate for me. I wanted to speak on Senate Bill 1421. So the important things, who am I? I am the founder of Our Kids Deserve Better Coalition. I did 10 months of research and brought it to Senator Dossett, and it became 1421. And 1421, all it does is codify rules and policy into law. The long term, what we hope 1421 will do, once it's codified, we can look at the training that is being done inside DHS. And my research started because I was watching providers who couldn't, I'm a social worker. I was watching providers who could not regulate their own emotions go in and try to take care of our children. And it wasn't the children that were the problem, it was the providers who had not been given emotional regulation training. I don't think anybody's at fault here. I think that the fact that the system was never meant to hold this volume, as well as the system and its complexities currently, it's just not something that they choose to take on because they really don't know emotional regulation training is missing. But I have studies and field studies that have brought why Senator Dossett agreed to take it. Now, it passed out of Health and Human Services unanimously, but here's where we are, and there is no anger or anything. We might have to wait till next year, and we're okay with that. We are okay with waiting till next year, but we need people on board so that when it comes back up, if it doesn't go through this year, it's still not dead, but there's a possibility that we will have to wait. I'm talking to some other people about possibly taking it on. If we have to wait, I just want to build the coalition. So if anybody has any questions, all this does, there's no fiscal note. There's no fiscal note. That's really important to know. And that's how I got, or all of us got Rosino to put it on the floor, but that's it.
Thank you so much. I appreciate that. Well, I'll look it up. Rep Fugate, do you want to give an update?
Yes, thank you. It's been an interesting day. Last week was painful with it being deadline week, lots and lots of bills moving. Leader Kirt, I think I caught a piece of your update where you were talking about property taxes. And I think the overall here is to just kind of talk about things that are moving through. Let me start with the issue of property taxes. And I'm just going to make a general observation. Property taxes have existed in this particular form in the state of Oklahoma for generations. This is not something new, not something that was particularly painful until today. And you just have to ask the question, what has changed? Well, the simple reality is over the last 7 years, we have seen the results of the STIT economy where people just cannot afford things anymore. We've lost 2 more corporate, Fortune 500 corporations. We can't seem to bring Panasonic or Tesla or Volkswagen or Canoe or anybody else here to the state of Oklahoma. When Kevin Stitt was elected in 2019, we were ranked 38th in poverty, which was bad enough. Today, we are ranked 44th. And all the meanwhile, we have Governor Stitt who's taking a victory lap saying that Fortune 500 corporations make more profit off of Oklahoma employees than in any other state in the nation. Well, that's why we can't afford property taxes. It's not because our property taxes are broken. It's the economy that is broken. And I'm really frustrated that I don't see my colleagues focused on that problem here at the Capitol. Instead, we have a number of bills that would cut anywhere from 40 to 60% off the value of property taxes for homeowners. It doesn't do a thing for renters who will still pay the list price for the property taxes on the homes in which they live. So, those who are wealthy enough or who are fortunate enough, wealth is not the only way you measure it, but fortunate enough to be able to own their own homes, get a big price break. But those who are having to pay somebody else for the home they live in don't get that same break. And ultimately, who's broken by these changes in property taxes? Well, it's your schools, it's your counties when they're trying to figure out how to pay for their sheriffs. Those of us who've been in the legislature will recall Rep Timmons is new, so she didn't have a opportunity to weigh in on this, but we were asked to fund county sheriffs in rural Oklahoma. We gave them pay raises and then discovered, oh my gosh, they don't have enough money from property taxes to pay those people. And so they came back hat in hand to the legislature and said, hey, you need to give us additional money to pay for these people. Well, they're paid for through property taxes. And what will happen if you wind up with a 60% cut in property taxes? Or, as some of the bills I think on the Senate side do, reduce them to zero. It's just lunacy. The Oklahoma government doesn't run on unicorn farts and pixie dust. But sadly, there are people who believe that. So anytime you hear somebody talking about property taxes, just look at them and say, it's been this way for generations. Why are they broken now? Insurance. Leader Kirt, I don't know if you talked about this topic specifically. Okay, I see you shaking your head no. So Leader Kirt and I were both partners on a couple of interim studies looking at the outrageous cost of homeowners insurance in Oklahoma. Mm-hmm. And one of the primary observations coming out of that was that the insurance commissioner for the state of Oklahoma does not have the authority to manage rates unless those rates are artificially low. Right? When people are complaining about high insurance rates, he just washes his hands and says, hey, I don't have the authority to do that. Well, we have a bunch of bills that are in play dealing with insurance. Chief among them were a couple of bills that Leader Kirt and I both authored independently, but focused on the same thing, that would have given the insurance commissioner the authority that he claims he needs. Guess what? Those have been killed already. Mm-hmm. So the number one thing he was talking about, we won't do. We still have bills on the House side, presumably on the Senate side as well, that will implement what I think of as trickle-down insurance, where we're going to make it easier for insurance companies to make money and hope that somehow that they're going to, out of the goodness of their heart, lower your insurance premiums. Didn't work with other trickle down. I don't think it's going to work trickle down here. We've spent, unfortunately, too much time today on the first day of kind of full floor work on what I think of as mailer bills. They're not bills that really advance the state forward. They're just, culture war issues. We had an abortion bill this afternoon. Lord, I don't know how much more anti-abortion we can be as a state. We've already gone back to the 1900s for our abortion statutes here in Oklahoma. We have a pending bill, wasn't heard today, but could be heard on the floor anytime soon, that would make it homicide for a woman who has abortion herself. And to what end? We had last week up at the Capitol OBGYN residents. I had 4 of them in my office. And I asked the basic question: how many of you plan to stay here in Oklahoma after you finish your residency? 1 out of 4. And she said sheepishly, I have lots of family here. She's from Owasso. And she said, if I didn't have family here, I wouldn't be here. They don't want to risk their careers and their opportunities to pay off their student loans. You take out $300,000, $400,000 worth of student loans, and you're going to stay in a state that says we're going to yank your ability to practice and maybe throw you in jail? No. We have a number of bills, election related, that I think we're fighting hard on. The basic tenor of those is to make it more difficult for people to register to vote. They like who they have registered now. To make it harder to, once again, run initiative petitions. It's already hard enough in the state of Oklahoma. We have several bills that attack the trans community here in the state of Oklahoma, as though it's not already harsh enough for those people. We now want to prohibit birth certificates from being changed after 1 year of the birth of a child. And to that end, and I'm sorry I'm monologuing here a little bit, Leader Kirt, but stream of consciousness, I didn't have a chance to prepare effectively for this, but a birth certificate is for identification purposes. And I think you're going to subject to somebody who's trans, subject them to an additional level of scrutiny that is a violation of equal protections, because somebody's going to look at their birth certificate and say, hey, you don't look like you're female, or you don't look like you're male, and your birth certificate says that. So now you have to prove to me that you are this person. Well, nobody else gets that level of scrutiny. And so to me, that's just wrong. We have restrictions on adoption that are the same way, where an adoptive family, if they adopt a child, older child who is transitioning, doesn't have to support that and can actively prevent it. Really? Maybe you just shouldn't adopt that particular child. I wrote in my notes HJR 1077. Brandy, are you still on here? I think Brandy, Rebecca, you were the one who brought up 1077. We have several bills seeking to dismantle TSET, the Tobacco Settlement Endowment Trust. Oklahoma is arguably in the best position for all the states that participated in the tobacco settlement, because we put ours behind a constitution that prevented the legislature from burning through all the money. The sad reality is legislators don't like the fact that we can't tap that money. And so the efforts that are in place today, there's one that dissolves the board of directors. There is another one that changes the makeup entirely of the board of directors. The HJR 1077 is being positioned in the legislature as a means to fund the higher learning access program for poor kids to go to college. Well, respectfully, we already do that today. That's required. And so that's just a straw man argument, because the practical reality is there are members who don't like the way TSET spends its money. That's it in a nutshell.
Yeah.
They object to sidewalk chalk art. They object to advertising in those places where weird people congregate. They object less to some of the things you were talking about in the physicians' manpower workforce, where we're putting doctors and nurses into rural hospitals. But they grumble about that. Believe it or not, they even grumble about that piece of it. We, on my side of the aisle, and I don't know that this is intended to be explicitly partisan, but we'll be standing firm against any changes to TSET. TSET works. It works very well. We protected it. We had a smart attorney general in Drew Edmondson who figured out how to keep the legislature out of it. And the last thing we need to do is open up the purse strings for the legislature to start handing out money the way we think is appropriate. Because Lord knows we don't seem to be making very good financial decisions.
Rep Fugate, I'm gonna hop in for a sec just because I know Marissa has to hop off, and then I'll introduce Rep Timmons. But first, Marissa, I think your point is incredibly well taken, and I have looked at the Healthy Minds research, and we have put additional funds into psychiatry residency slots, but really not done the other investments that have been recommended. And you are absolutely right. And I'm deeply concerned about loss from the field as well as people moving away. And I think keep raising that flag. I think the pipeline is not rebuilt. It's having a hard time. So thank you for raising that concern.
Yeah, no, I appreciate the opportunity to speak about it. I know it's a concern that myself and other students in my program, sorry, I'm getting over a cold too. There's a whole thing going on over here. But I really appreciate you saying that. And I know that you mentioned psychiatry. Social workers do provide the majority of mental health services in the country as a whole. And so I really appreciate that. I'm not trying to say, but no, I really appreciate you guys taking a look into that. I do have to hop off, but thank you so much.
Thank you for being here. Really appreciate it. And we can follow up if need be. I wanted to introduce Rep Timmons. I know she just came off the floor, and this is probably, a harsh wake up because this is her very first session. And so this is her very first long day on a very first session. So thank you for showing up. Rep Timmons, we ask each member just to talk about, an issue or two that you think are the biggest things you're concerned about or watching. And you also could tell one thing you're proud of that you're working on, if you're willing.
It was interesting watching some of the legislation today, in particular in a tight budget, the money that's being wasted on things that don't go to the health and welfare of Oklahomans is maddening. I've been railing about childcare and the subsidies and how we've got daycares, 500 closing across the state of Oklahoma. That means working folks can't go to work. Somebody's got to stay with those kids, or either you leave them at home, and then we just swell the rolls of those people who are involved with DHS because they've left their kids at home and they don't have a choice. Daycare is an issue for me. Also today we had a bill that talked about pregnancy help and pregnancy investment. And what they really mean by that is anti-abortion and pro-life nonprofits that they are invested in giving taxpayers dollars to, and we have no way to know how it's being spent. And we already know what they're doing with it because we had a group that they found $2 million for, which I was livid about 2 weeks ago. They did an emergency appropriation to Choose Birth, who basically said they're giving out diapers and formula, but that's what WIC does. But when we asked them who they're serving, how much money they spent on those things, how many people they had no answer for those and said, we'll get back to you on that. And so our main concern was, what's the oversight on that? And then why are we in a flat budget year handing out money to private nonprofits that we don't have any control over or oversight over, that can't tell us where the money's being spent. Those are two of the things that I was just incensed about. And then we have a bill that is, to me, clearly unconstitutional that passed today that talked about removing all the books in the library that have any kind of sexually explicit material in them. And you know, that's not the standard. You know, the standard is in the bar case, basically, that says, I think it's bill. Well, anyway, I don't have the citation with me because I didn't look it up today. But Rep Fugate did a good job of explaining that the law is already there to keep sexually explicit that has no redeeming societal value or cultural or artistic value away from our kids and citizens. And so it was much ado about nothing, but it restricts what our kids can see, what they can read. And it also is broad enough to include a lot of the classics that might have a reference to something obliquely sexual that they're going to take off the shelves. And I'm just amazed that in this state where we have 50th in education, where we have domestic violence, we're in the top 10 in the country, that these are the things that they're worried about. I mean, we've got bigger fish to fry. And last but not least, I'm going to say this, and you all may not agree with me, but we got a whole state that can barely read above a third grade level. And we're worried about sexually explicit portions in books that most of our people can't even read. You know, if we read at a higher level, I would worry about that. But we can't even, people can't read. And it's just maddening to see that. And so today was a long day, and it was interesting to see how the arguments went back and forth. I'm proud of the Democratic caucus for holding the line, for taking them to task, for questioning, for not voting for those things that are performative and just are done for clickbait. And I don't think all of my colleagues on the Republican side were doing that, but there was certainly an argument to be made that some were. And so we just got out probably about 20 minutes ago, maybe, if that. So I'm still ready to go.
So Rep Timmons is a former judge, and so she's had quite a bit of time on the bench. It's going to be interesting for you, the lack of evidence that happens around bills. I think a lot of people, when they watch our proceedings, are pretty surprised by the lack of data and evidence that we walk in with. Sorry, Rebecca, for your entire field. But it's definitely
I'm
needed.
surprised at them passing bills that are, to me, clearly unconstitutional.
Oh,
with not a problem at all. So that
So
means
people-
that somebody's going to have to challenge them.
Yeah.
And they're going to be unconstitutional. And I'm thinking about a bill for next session that says that if you pass something that's clearly unconstitutional and someone has to challenge it, that the legislature, the individual legislator who knew or should have known it was unconstitutional, has to pay for the attorney fees out of their pocket. So I don't know that it's going to go anywhere. It might make a statement, though.
I think people are often ask me, like, how is it that so many legislators can file unconstitutional bills? Just so you know, we can file what we want to file. So we have lawyers on staff and we have policy people on staff who help us write bills. And they might say to someone, this may have some constitutional challenges. I've had them tell me that before. Like, I wanted to run a bill about electric rates, and they said, well, you can't tell the Corporation Commission what to do about this. You can recommend, you can do these kinds of things, but you as a legislator decide, are you going to listen to that staff concern, or are you going to just file it anyway? And I think that's what we're seeing.
Yeah.
Anyone else have a big issue we want to talk about before we wrap up?
I believe
I just like to
Brandy
say
had her
that
hand up.
You all need to understand.
Go ahead, Elizabeth. I can't see very
important.
Everybody. So
I'm sorry. Your voice is important. We want to hear from you. It makes a difference on the floor. If people are emailing us about certain things, your voice is critical to this thing that we do. It may pass anyway, but the more you interact with the legislators that you know are passing things they shouldn't be, the better it is for us. Okay.
Is that JJ? Did you want to hop on, or yeah, go ahead. It's still showing up as muted. It's okay. Well, if you want to post in the chat a discussion topic, Brandy, did you want to jump back in? Or was your hand up from earlier?
Yes. Yes. No. I wanted to say to Representative Timmons that is often a conversation in our coalition of Our Kids Deserve Better about the money we waste on passing and then defending unconstitutional bills. So you and I should talk.
Okay.
And then I have a question for every legislator here. With the merging of all these like departments, do you see the whole governor having the most say, that kind of thing, more of an issue than the budgets decrease and the expectations stay the same and the optics always have to look the same, so we end up with fraud? We set these people that the governor puts in up for failure because they have to look like they're doing well, they have to show numbers that they're doing well, but the budgets are nowhere near where they can do that well.
Yeah, that's a great question. I mean, other people may want to chime in. I know for me, I come out of the nonprofit sector, and in my sector, we did a lot of talking about outcomes and what kind of outcomes we're trying to seek, what our goals are. And that language is not common among all my colleagues. Frequently I'll ask about outcomes and they'll just say the outcome would be that all the credits were used, which would mean basically we spent all our money and that would be success. And so I think we have a real lack of broad understanding of what it means to plan and set goals. And what Rebecca talked about, I think is really important because we talked earlier this year with a leader from the Health Sciences Center just about statistics 101 and that language that we might be lacking when we're thrown in here as citizen legislature. We may not have that language. And if we don't empower our agencies in that, we actually don't have a planning function that's across agencies. And unfortunately, a lot of that planning happened because the federal government mandated it. So I'm even concerned that the amount of planning we've done in the past is going to go down. So you'll see less of that coordination and less of that goal setting. That's my big worry. And yes, I agree. I think resources and being honest with ourselves about where we need to improve are incredibly important next steps. Fugate, were you trying to hop in there? Or
Oh, sorry.
Yeah, I would agree. One of the fundamental problems we do have is that we have shifted for some of our largest state agencies the immediate hire fire authority to the governor. And, back in the day, historically, that used to be a decision that was made by the boards who were appointed. And those boards were not people that could be removed at will. And so there was a lot of thought put into who would serve on a board, the experience and expertise they might bring for the next 6 or 7 years to that critical piece. Today, as we see with, for instance, State Board of Education, if they don't line up and toe the line exactly where the governor draws it, well, he's going to replace them and put somebody else on that board. And that means for many of our boards now, they're nothing more than just kind of showcase boards. The actual decision making is being done by a person who's appointed by the governor under the same restrictions. Do exactly as I say, or I'll get rid of you and put somebody else in. And the track record for this governor has been pretty abysmal about the people he appoints. The one other thing I would say in terms of budgeting, we do budgeting wrong here in the state of Oklahoma for government budgeting. We sit down and say, this is how much money we have. Okay, let's figure out how to spend it. And you wind up with these situations where everything is a flat budget because politically you want to tell people you're, holding down the costs. And then all of a sudden you wind up with magic money that's found, whether it's $2 million for crisis pregnancy or $312 million to go purchase a used jail. But it's all part of this mindset of efficient versus effective, efficient government. I keep hearing Republicans talk about efficient government. Well, efficient government says you're going to make it easy for people to drive on the turnpikes, right? But it's not effective because 30% of the people driving on those turnpikes will never pay a dime to do it, and the rest of us will pay more. It's the reason why we pay $10 to go to Tulsa now instead of $4 to go to Tulsa. The metric should always be effective government. Is this the most effective way of spending our money? Is this the most effective way of tackling this issue? Not is it the most efficient?
I think JJ was able to get her. Are you able to unmute now? Do you want to try again? There she goes.
I figured out Teams, you guys. Sorry. I am also a Google gal. So forgive me. I am fairly new to this state, and what a learning experience this has been. I have worked in education, serving marginalized communities since 1997. And it's so interesting to me. And I just from an external point of view, like just coming into this, that I think, great, I feel like it doesn't sound like there are budget issues. It sounds like there are spending issues. Representative Kirt, I believe you broke down some data from the school voucher program about who it serves, and the amount of money. And it seems like that program has not impacted the state's literacy rates. So it's a large chunk of money for the state, and it feels like it could be better utilized in possibly expanded learning, which is adjacent to, it's a term from my other state, but expanded learning is adjacent to childcare. But it really does take advantage of after school and non-school days, such as summer programming, to offer a different type of teaching for students who may need to learn different. So the learning is still happening, but it's happening in a way that does not look, sound, or feel like the regular school day. I'm curious about, and other states, there's 21st century funding, which is the federal funding. A lot of states, more and more, are also adding state funding to help serve communities. It seems to be pretty bipartisan because it gets families back to work. Is there hope of expanding these opportunities for families?
Thank you for that. I know that Senator Goodwin, do you know anything on this topic? Do you want to hop in there?
You know what?
I've got comments, but I don't want to dominate. So
no. I just know that she's absolutely right that there are no guardrails when it comes to those dollars that are being provided to these students that are going to private schools. I'm always been a no vote on that, and it makes no sense. I remember when they went from 3 million to 30 million to 300 million, and I've watched it increase. And to your point, I think you asked, is there any hope? And hope, yeah, there's hope. It's called turn this legislature around, get more folks in that think like you do, and don't give up. Yeah. But in the meantime, we are kind of in this abyss, I think. We're going in the wrong direction. To your point, it doesn't in any way affect the learning that you're seeing. We're still, that money, there's no accountability. And that is said on the floor all the time. And when we ask about, can you show us how our lives been improved? What are the literacy rates? Are the kids improving? They don't have an answer for that. And they don't intend to get one because they're doing what they do. But Senator Kirt, I know you've got a lot to say on that.
Well, I just wanted to say that, absolutely there's ways we can improve our spending, and there's no doubt that there's funds out there that are not being well applied but I just want to point out that we have hundreds of millions of dollars of corporate incentives and tax credits that are not tightly accountable. We also have cut $1.6 billion in taxes over the last 5 years. So experts are saying that we're structurally unsound again as a budget. So that's for money that should come in every year to fund the regular things that we need to do. And so I think that's why you see proposals like the Republican Senate education leadership saying we were going to redirect money that was dedicated to the pensions to spend on current schools. And that's because they've cut back our tax revenues so much so we don't have flexibility to take care of the needs we have. So I'm glad you brought that up because I was shocked to learn that other states have after school and summer enrichment that's paid for by the school district. And, during COVID, we had that in some areas and it was very positive. It was so great. And but meanwhile, as Rep Timmons pointed out, we are not funding our child cares to survive. So we are not thinking we're still in Maslow's bottom part of the pyramid in terms of well-being and safety. And so it's tragic because we cut back the school-aged subsidies. So we're talking about children I believe starting at age 9 are no longer qualifying for subsidy. And I know my 9-year-old could not stay at home for 3 to 4 hours after school without care. So I think we are deeply upside down on priorities there. And, we have funded, as Rep Timmons pointed out, the $4 million for an out-of-state nonprofit doing programming, but we did not fund the $5 a day that was keeping our child cares afloat. So I'm concerned about it. I think we have a lack of imagination there, and you bringing that voice from another state's really important, because truly it was one of those things where I was like, I didn't know that other people's state departments of education did that. Like, that's great. So we need to hear those things that could be great for our community.
Before COVID, our state had $550 million worth of state funding. And in 2021, the governor upped it to $4 billion and made after school access for all. So it became an appropriation rather than a grant. I'm not sure if that was the best rollout, but it's a huge deal, right? It's a lot of money. And it required all schools to do 30 non-school day programs that lasted 9 hours. And all after school and before school programs had to equal 9 hours. That number, as we can guess, is an 8-hour workday with a 30-minute cushion on either side to get your kid to and from that program, right? So it's for working families.
That's amazing.
Sorry.
I see Rep Fugate has his hand up, but I'm going to let Velvet hop in there first, and then we could let Fugate close us out, maybe. How about that? Velvet?
Hi, good afternoon. I just had a question if someone could tell us what's happening around Oklahoma Healthcare Authority and the funding that I guess I read we're like 571 million in a deficit in that particular funding as they are looking at rolling back the expansion of healthcare.
Yeah, I've got major concerns about that. We might have Fugate jump in because I know that there's a House bill moving that would send a question to the people to get rid of Medicaid expansion if the federal funding formula changes. We know that state question, some of you may have been volunteers on that state question, volunteers in the health community really pushed Medicaid expansion. They put it in the Constitution for a reason because they knew that the legislature would not do its job if we were allowed to change it. So that part is in the Constitution. I don't see how we can get around funding it. But it was interesting in the governor's proposed budget, he only funded half of it because he thinks magically he's going to be able to cut people off Medicaid. Fugate, do you have additional comments on that?
Yeah, it's no surprise that the governor has no idea how any of this stuff works. He shows that every time he talks about stuff going on at the Capitol. So the bill you mentioned, Leader Kirt, was heard in the Rules Committee last week. It's a bit of an end around. It doesn't exactly get rid of Medicaid expansion. What it does say is if the percentage match drops from the 9-to-1 that we get today, that the state can elect to not fund the difference. So it doesn't get rid of it, but it does raise the question, well, then who would cover the cost? Well, that'll be your hospitals and your providers that will eat the cost. which will have the pernicious effect of putting them out of business. And we tried to point this out in committee that the ones who would be hurt the worst, frankly, are going to be those in rural Oklahoma. So you're killing your rural hospitals by cutting off your nose to spite your face. I think it will pass through the House with flying colors. The question will be whether it will be killed on the crossover. And I can't speak for my Senate colleagues, but if I had a crystal ball, I'd say this November you'll be looking at that, if not sooner, because the governor could put it on an earlier election date if he so chose. Oh, and one other thing, completely on a previous topic, the question about 9-year-olds. I'm willing to bet, and if you polled my colleagues, probably half of my Republican colleagues would say those 9-year-olds shouldn't be home anyway. They should be working.
And I just want to say real quickly to Velvet, as she talked about the 571 million, it's not like that just happened. When you cut 0.25% out of your income tax, again, we're going right back to where we were some 11 years ago. You cut your income tax, you're going to have less money in terms of how we address certain issues. So Velvet, I know you're concerned about how does sickle cell, those initiatives get funded. There's a lot that we're concerned about how it's going to get funded. And we cannot overlook the fact that they make these very calculated decisions to cut 0.25, and it's going to continue to be going down. So we're at about 4.5% now in terms of our income tax rate. And we were at one time at 4.75, and we were at 5, and so we remember all of this. And we've watched ourselves cut money, and when the money is cut, Velvet, you do understand they're the first. We talked about the rare diseases earlier, and those will be the first areas that they're going to target, no question. Yeah. And it's not right, but it is concerning.
Thank you for that. I missed Mary Claire, I think, wanted to ask or say something. Do you want to hop on there now?
Hi, thank you so much, Senator Kirt. This is such a big deal for me. I'm also not from Oklahoma, so I'm still learning a lot about this process, but I do feel very honored and privileged to have the opportunity to be here today. I am an intern currently as a graduate student in the Human Relations Department with a program called Sooner Works. It's an IPSE program, inclusive post-secondary education program at the University of Oklahoma in Norman. I don't know if you've heard of it before, anybody, but we also have one of our students. He's a senior with us, Jacob. And so I kind of wanted to bring awareness to our program as it is, it falls under the IDEA, protections, and just how it is a very vulnerable and marginalized community. And we do struggle with funding, with scholarships, with grants for our students. It's a very haves and have-nots world. So just if there's anything we can do to support this program, we definitely need a lot of advocates and allies on our side, just to support us with funding, because it has the word inclusive in it. It's like a bad word. So we are struggling a lot with that, and just from getting support from even the people within our own college, but from legislation. And we have our sophomore class coming to the Capitol tomorrow to meet with representatives. So we're very excited. So this was an opportunity for Jacob to take part in this, to also recognize that, as Representative Timmons said, our voice matters. So we are trying to show our students how important it is to use their voice, that they have this power, and to use it to speak for themselves, for their peers, and just how to support one another. So that's all I really had. I did see something about a corporal punishment, something that has to do with students with disabilities bill. I'm not really sure too much about that. I don't have too much information. Yes, sorry, go ahead.
Yeah, so that last year we did pass a bill that finally banned corporal punishment on people on IEPs, and that did take multiple years. Okay. Thank you for speaking from the Sooner Works program. Good job on wearing your OU shirt, and Jacob, good flag back there.
Yes, thank you so much. We appreciate it.
Jacob, did you want to say anything, or are we going to see you at the Capitol tomorrow?
Well, Um, I'm a senior at the University of Oklahoma, just like Mary Claire said. Um, and I'm I'm working. I'm trying my hardest to become an Oklahoma resident. I'm just and Mary Claire said she's not from Oklahoma. I'm not from Oklahoma as well. So um, I think about what you're all saying about this disability. Um, sorry, I'm backtracking. I I think it's important for people with autism and a bunch of other disabilities like Down syndrome being able to stand up to themselves, because those kinds of people are not um being paid the most attention to. Uh, because I mean, I couldn't. I don't want to sound too personal here, but I couldn't talk till I was like 7 years old, and I live I lived most of my life with autism spectrum disorder, and so it was kind of hard for both me and my family to find the right kind of stuff for me to take part of, like in school or outside of school and everything. So I just kind of want to let my voice be heard and advocate for for people with disabilities, that so that their voices can be heard.
Thanks so much, Jacob. That's awesome. I'm so glad you said that. And I think, especially for someone who didn't speak until you were 7, like it's even more for
Did a
people to
great
know what
job.
that's just amazing. Just,
Yeah.
I hope we get to meet you tomorrow when you're there. I think Sooner Works and other IPSI programs are really important. And I think this goes hand in hand with us having a better imagination for everyone in our state to be able to reach their full potential and have those programs and resources and inclusivity that matters going forward. Okay, with that, I'm going to see legislators. Do you have anything other major you want to say? Not, not another full monologue, Rep. Fugate, but like something, anyone want to say something brief? Senator Goodwin.
Yeah.
No, thank you. And it's always good to hear from people
It is.
living real life, helping us
Yeah.
figure our way forward.
And I would like to say this. You all, we've had Republican majorities, super majorities in this legislature for the last almost 20 years, and look where it's gotten us. And you all really need to think about when you're whichever side you're on, how that leadership has tanked us in ways that are material to everyday citizens and everyday people, in terms of their health, in terms of their ability to make a living, all of those things that we measure for the least of us should be a baseline, and we are well below that, and that is disturbing to me. So if you're a Republican or a Democrat, if you are talking to Republicans and they're supporting some of the things that are cutting the legs off from under the least of us, you need to rethink your vote, because it matters, and
Yeah,
that is why we're where we're at.
Sorry, I didn't mean to. It's so hard to
You're
judge
okay.
space and time on the Zoom action, isn't it? I just want to add that, also our independents, our lovely independents. I think one
Yes.
of the things I've heard when I've been out in community is people who stand for whatever party, one party or the other. And if they say, I'm going to vote this way no matter what, that means they're not going to hold me accountable if they're voting for me. So I think I encourage everyone to look deeper at their member and
Yeah.
hold them accountable and expect more out of all of us. So Rep. Fugate, anything you want to add before we wrap up?
Yeah, let me start by apologizing for sucking all of the air out of a conversation for the period of time where I monologued.
All right.
I should have asked for some parameters instead of just going off. I will leave you with this thought. It's pretty clear after the last 20 years that the Oklahoma standard has become substandard.
Amen.
And Thank you, Rep. Fugate. I really appreciate you all being on. Thank you to everyone who came. Thank you to our fabulous ASL interpreters. Love to see you at the Capitol. Glad to hear from you. We will have our Elizabeth, will you remind me the next Capitol conversation in person?
The next in-person Capitol conversation is the 30th of this month. That's a Monday, and it will be the same time frame, 5:30 to 7:30 p.m. at the State Capitol in room 535.
So you're welcome to come in person. Absolutely no requirement, but glad for you to share and glad to hear from you. Even if we're not your representative, we're definitely folks who want to learn and want to know what you're learning in the community. So hope to see you when you're at the Capitol. Thank you, Elizabeth, for your work, and thanks to everyone for coming tonight. Take care.
Bye.
Thank you.
Good luck,
Thank you so
Jacob,
much.
with graduation. Hope it goes smoothly.